So I had a question relating to what a confounder is, or how to draw a causal diagram for a confounder. So you have to remember that a confounder is related both to the exposure and the outcome or disease. So in this case, if you have your exposure and it causes or precedes the outcome, then your confounder would be related related to your exposure, and it's also related to your outcome. So if you have your arrows pointed like that, that would be a confounder. An intervening variable, you have your exposure and it goes through the intervening variable to get to the outcome. So you would not control for that in your models, but you would control for a confounder. So an example from the old midterm that you were having a problem with. So the questions was that researchers believe that high levels of serum PFOS will result in an increased odds of developing breast cancer. So serum PFOS would be your exposure. It's an E. And it goes and it causes breast cancer. So that would be your disease or outcome. And then they also say that consumption of high levels of seafood. No, my rat just stepped on my... No, go. Sorry. They also say that increased consumption of seafood reflected in high N3, N6 fatty acid ratio. So we know that's going to be in here somewhere. Can reduce the risk of breast cancer. So it's going to be related to this. So the arrow points this way because that is causing a reduced risk of breast cancer. And then it also says that high seafood consumption is related to lifestyles that reduce exposure to PFOSs. So that arrow is going to go that way because this is reducing exposure to this. So based on this, it is a confounder because it's related to exposure. It's decreasing the chance of you actually being exposed to it. And then it's also related to the disease because it decreases your odds of getting breast cancer. So based on the way the arrows are drawn, it's a confounder because it goes like this. If PFOS is for some reason changed your N3, N6 fatty acid thing and it went like this, then it would be an intervening variable. So hopefully that helps. And there's just a breakdown of it.